student, today we are going to see this another one important topic which are related with this male and female reproductive system, that is the sterilizations. In the sterilization we have to see the outline of objectives, introduction, male sterilization, female sterilization, and their summary. So the sterilization is the one of the surgical methods or surgical methods, also called the sterilization, and are used when couples require no more children. The surgical intervention blocks the transport of gametes and thereby prevent the conception. That is the sterilization procedure is in the male is called the vasectomy, and in the female the procedure is called as the tubectomy. So in the vasectomy, a small part of this vas deferens is removed or tied up through a small incision on the scrotum, whereas in tubectomy a small part of the fallopian tube is removed or tied up through a small incision in the abdomen or through the vagina. And these techniques are highly effective but usually irreversible. In fact, sterilization is a full method of contraception and the failure rate is extremely low, that is less than 1% only. So this introduction to permanent family planning of this surgical procedure to permanently and intentionally terminate male and female reproductive functions, appropriate for men and women who made a fully informed and well considered decisions, and most are not reversible. That is permanent family planning, vasectomy for men, and tubal ligation in the woman. So the vasectomy for men who do not want more children, so the couple they are decided to do the vasectomy. So the transaction and the conclusion of this vas deferens, also called the male sterilization, male surgical contraception, and there is no interference with sexual performance, and outpatient procedure by the local anesthesia. So the techniques of vasectomy is the scalpel and the non-scalpel. The palpate the vas through the scrotum, grasp the vas with fingers or forceps, and pull loop of vas, remove segment, and ligate one or both ends of the vas deferens, and bury the proximal stem. So you can see this image of the vasectomy. So there is a scrotum and this incision on the right sides, and this right vas deferens, and cut it and tied it, and that is remove this vas deferens here. So you can observe the left seminal vesicle, left vas deferens, and this vas deferens they are transported the sperms in the ovary, and these incisions on left of scrotum and the tunica, the half of the duct removed and the ends are the sealed or the tied with the stitches. So these indications for the delaying the vasectomy: active the sexual transmission diseases, swollen tender testes, the scrotal skin infection, then bilateral undescended testes. The benefits of vasectomy is the failure is less than 1%. Reason for failure can be unprotected intercourse, failure to conclude the vas, and recanalizations. The safer and more effective than tubal ligation, 0.5 deaths per 1 lakhs the vasectomies. The applications of the vasectomy side effects are uncommon to very rare: testicular and scrotal pain lasting for months, and surgical site and infection, then the hematoma. This female sterilization you can observe this for women who do not want more children and or with medical problem, also called the tubal sterilization, and this tubal ligations, tubal ligation, and voluntary surgical contraception, most widely used globally, 210 million couples and 28% in the US. So the non-popular in Ethiopia, only the 0.1% conclusions of the tubes in some form. You can see the Pomero methods. Timing of female sterilization at the time of the cessation section. Postpartum mini-laparotomy, interval mini-parotomy, concurrent with pregnancy termination. So these methods of the female sterilization, that is abdominal, the laparotomy, the mini laparotomy, then vaginal laparoscopy, hysteroscopy, different surgical approaches. The mini laparotomy for tubal ligation of the fallopian tubes through 3 to 4 centimeter incision on the abdomen can be done as an outpatient procedure by local anesthesia and sedation. This mini laparotomy, Pauline vaginal delivery, and large uterus tubes in the mid abdomen 3 to 4 centimeter, the umbilical incisions. So the interval mini laparotomy, it is one of the short transfer the suprapubic incision, uterine elevator used through the vagina, and the indication to delaying tubal ligation. Current pregnancy less than 6 weeks, postpartum, severe postpartum or post-abortion complication, unexplained, the vaginal bleeding, pelvic inflammatory disease and STIs, pelvic malignancies. Then benefits of the female sterilization. There is no known side effect, helps to protect against unwanted pregnancy, and nothing to remember and no worries about the contraceptives again. So this method, they are benefits of the female sterilization. Prevent against the pelvic inflammatory disease, may protect against the ovarian tumor, and the risk of this female sterilization is few complication related with surgery, anesthesia, previous surgery, obesity, and 1 to 2 deaths per 1 lakhs cases, and 2 pregnancy per 100 women over 10 years, possibility of future regret, young age, lost a child, few or no children, not married, the marital problems, and the counseling on the female sterilization. The counseling is critical. The potential risk, benefits, possibility of later regret, possibility of pregnancy mostly ectopic, and the summary is permanent methods are irreversible. The non-scalpel vasectomy in men and the mini laparotomy for women are preferred, and the permanent methods are less popular in Ethiopia, and detailed counseling is essential, rare complication and not related to methods. And the case study, you can see the sterilization, that is the vasectomy and tubectomy. It's 20 years old woman come to your child for family planning, and she and her husband decided that the tubal ligation is best for them. The couple has one child, and what important issue would you like to raise during the counseling? For take the 3 minutes to reflect, and these considerations, in the case you check if it is well through discuss the possibility of future regret, as the method is reversible, and the mention of her alternative family planning methods. So in the sterilization and termination, there are important to morning after pill abortion, that is RU486 contain high dose of steroids, principally estrogen, and the abortions. Then this male and female infertility is there. The causes of female infertility is failure to ovulate, production of infertile eggs, damage to the oviducts, damage to the uterus, damage to the cervix, antibody sperm, genetic causes, recurrent abortions. Then the infertility associated disorders is the endometriosis. Endometriosis means it is a painful condition characterized by the proliferation of the endometrial cells outside the uterus, and parts of the endometrium break away and grow elsewhere, particularly in or around the ovaries or oviducts. then polycystic ovarian syndrome, then the primary ovarian failure, and this STI, that is disease of infection in the reproductive tract. So this is about this female causes. And the male infertility is, you can observe these causes of infertility: the testicular failure, infectious of epididymis, hypogonadisms, cryptorchidisms, congenital abnormalities, varicocele. Varicocele means the male fertility is also caused by this presence of the enlarged veins in the scrotum, which produce excessive heat near the developing sperm. Blockage of the sperm, absence of the sperm, then low sperm count, abnormal sperm morphology, reduced sperm motility, and autoimmunity. So this is about this sterilization, and this sterilization which are related with the male and female sterilization. That is, this male is known as the vasectomy and female is known as the tubectomy.